Heat stroke. Heat stroke is a condition that may occur when the body is exposed to excessive heat. It results when the body is unable to lose heat effectively and maintain a normal temperature. A serious disorder, it is fatal if not treated. Symptoms. Heat stroke usually produces sudden delirium or coma. Often it is preceded by varying combinations of dizziness, headache, numbness or tingling of the extremities, restlessness, and mental confusion. The most serious sign, before the patient collapses, is a cessation of sweating, which causes a rapid increase of the body temperature to levels at least as high as 105 degrees Fahrenheit. The temperature rise is accompanied by a doubling of the respiratory rate and an increase of the pulse rate to as high as 150 beats per minute. Blood pressure rises at first but later drops as shock develops. Treatment. The treatment of heat stroke is aimed at reducing the patient's body temperature to about 104 degrees Fahrenheit within the first hour. It may be accelerated by immersing the patient in a cold bath, spraying him with cold water. Cooling may also be accomplished by having fans blow over wet sheets wrapped around the body. Circulation to the skin must be maintained and can be stimulated by vigorous massaging of the extremities. Bed rest and sedation are necessary to reduce the production of the body heat. The degree of recovery is related to the severity and duration of the patient's fever. After the body temperature has dropped to normal, it may rise again to about 104 degrees Fahrenheit within the first day. Cooling techniques must be repeated every time the patient's body temperature rises. In some cases the temperature may rise repeatedly for as long as a week. Related disorders. The metabolic processes of the body produce heat that must be lost to the environment at a rate sufficient to maintain a constant body temperature. Heat stroke occurs when the body loses its ability to maintain this temperature regulation. Other heat disorders are due not to an accumulation of the body heat but to specific disorders of salt and water balances in the body. Heat cramps result from an excessive loss of salt through sweating. They can be prevented by increasing the dietary intake of salt, for most people about 3 grams more salt than they usually eat. Limiting one's intake of water while working will also prevent heat cramps, but it may lead to a more serious failure of temperature regulation. Heat cramps occur in individuals who work in high-temperature environments. They usually occur late in the working day after the individual has taken much water. The twitching of the muscles, followed by spasms, can be corrected by taking salt tablets. Heat syncope, a disorder ranging in severity from lightheadedness to coma, results from an inability of the circulatory system to maintain an adequate flow of blood through the body tissues. The body temperature may be normal. The incident is usually self-limited, requiring only rest and cool surroundings. Heat exhaustion is due to a serious loss of water and salts. It results in confusion, fatigue, nausea, and loss of appetite. The treatment of heat exhaustion includes the intravenous replacement of lost fluids and salts.
Thank you for watching. Please like and share this video to your friends and family. Wishing you and your family many blessings.